guys, it's Tina Sheth here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And we are going to be talking about what frozen shoulder, or in medical terms, adhesive capsulitis is today, and what we do here at Rebalance that can help that. Now, first, I need to talk to you a little bit about what adhesive capsulitis is. So basically, your shoulder joint is a ball and a socket, or a ball and a socket joint. Okay, this is part of your shoulder blade. This is part of your arm. And when that makes that connection right in through here, okay, when you have this connection right in through here, that is the ball and this is the socket. So what we look at is we see that you have this ball and socket joint. Now on top of this joint, okay, below the musculature of your shoulder, you have something called a capsule. And that capsule is what can become irritated and inflamed. And when that happens, it basically will cause a lot of pain with movement of your shoulder, but it can also cause a ton of stiffness. And so typically what you'll see is that initially your shoulder may start off like, oh, it's a little painful. Or it may start off of, that's really weird. I used to be able to reach behind my back. I used to be able to reach up high and grab that, but it feels like something's stuck. Typically what we see is when people feel like they have to reach behind their back or put on their coat, that's when they notice, something just doesn't feel right. Okay, that's what typically we see that it starts off with. Now, that's as if it comes on gradually on its own, but sometimes it can also come on with a fall onto the arm. It can come on with trauma, and various different reasons as far as what can set it off. Now, why people get frozen shoulder, hard to say. They haven't been able to show like this huge correlation with certain things as to why people get it and what gets that mechanism to start. It's almost like your own body's protective mechanism of doing this, and it makes it bogged down and tight. What we have seen is, unfortunately, women that are Caucasian, that are thin, slender females tend to get this more than males. And so basically, this capsule starts to become really tight, adhered, and restricted, and then that's going to affect your range of motion. It can become very painful. It can be painful at rest. Sometimes it's pain just with movement. Other times it will, if it starts to get pretty bad, you can start to have pain at night, which then interferes with your sleep cycle. And then obviously, it's going to interfere with function, meaning reaching behind your back, females clipping your bra, combing your hair, all sorts of things, lifting, you name it. So basically, what do we do now for frozen shoulder? Now, oftentimes what you may hear, what you're told is go to physical therapy. And typically with physical therapy, they'll do a lot of stretching and range of motion exercises. And that's what you'll be working on, along with modalities. Modalities meaning ultrasound, something called electric stimulation, and maybe some heat and cold, okay? Now, what we've seen can definitely help to start getting some of your range back. But what we have seen is that sometimes you might get part of your range back, but it's still painful. And so then you're kind of let loose and told to go home and continue to do these things, because with time it will improve. And I'll tell you about kind of the 3 stages in a little bit. But oftentimes what we find is that's not enough, okay? That most people don't get their full range back. They're still having problems with their shoulder, or maybe it gets better, but then they're still having some pain with certain movements that they're trying to do, or they feel like they have to give up an activity that they used to do, like playing baseball with their kid, or throwing something, or lifting, or even reaching overhead, or going to the gym and being able to get back to certain exercises that they used to be able to do. So with adhesive capsulitis, what the 3 stages typically are is that there is a freezing state, meaning it's starting to get tight. There's a frozen state where it feels like, okay, it's become as tight as it can possibly be, and now it's just kind of staying there. And then there is a thawing state. So over time, the shoulder can actually start to unravel itself especially with the help of intervention such as specific physical therapy that we do. And that process, okay, sometimes can be months to up to a year sometimes for people, if not longer, okay? So just to kind of give you that time frame, again, everyone is different. Now, what we do here at Rebalance is our belief is that, that not only the capsule, but a lot of the musculature that goes on top of that capsule, okay? So you've got the ball and socket joint here, you've got the capsule that goes on top, but you have a lot of musculature that starts up into the head and neck, into the shoulder, into the upper back. All of this can actually play a significant role that we've seen in adhesive capsulitis, especially for the patients that we've seen here at our clinic, okay? What we will see is that not only do they have a frozen shoulder, but then because they've been kind of compensating for a long time because they didn't realize that this was happening, a lot of the head and neck and the upper arm, into the biceps, maybe into the triceps, into the upper back, all of that starts to also get involved. And when that happens, you're not only dealing with a frozen shoulder, but you're also dealing with a lot of musculature that's kind of bogging your whole shoulder and your head and neck down as well. And so it's not uncommon for people to have frozen shoulder, but to also have head and neck symptoms. And then that can spin into something else. And so we here want to treat all of that together. So at Rebalance, what our philosophy is that you have to treat everything from the inside out and the outside in. So you have to treat this in a holistic fashion. Giving just stretches and strengthening for your shoulder typically is not going to improve it, especially if it's been a chronic condition. You actually have to treat the entire area, including the head and neck, and sometimes even down below into the rib cage. So all of these things, once you start to soften all of that tissue up, and there's various techniques that we use here at Rebalance to soften that tissue up, from something called Graston or Iastim, to trigger point release work, to soft tissue massage work that we do. And then there's also specific other tissue interventions such as friction massage and all of these things that we do to really start to soften up the tissue, which is then going to influence that capsule to soften up. And then we do specific work onto the actual joint, okay, to start getting that joint to really stretch. And then we incorporate that with stretching and strengthening. And so all of that together starts to improve range of motion, functioning of your shoulder, and starting to get back to, some of the activities that you felt like you can't do or you couldn't do before. So I hope that it was helpful in terms of why this happens. We also do work with a lot of other really great orthopedists and physiatrists that sometimes will also get involved if the capsule is highly inflamed and you really need a lot of pain management in the beginning. And then we will incorporate the physical therapy and the specific type of intervention we do here at Rebalance to kind of further progress it and move it along. So I hope that was helpful for some of you who are looking for more treatment for the frozen shoulder that you have. And if you have any other specific questions and you're looking to come in and have treatment with us, then you may qualify for a free phone consultation for us to kind of figure out if you would be a good candidate to receive treatment with us. And then again, we've got lots of other helpful information on other YouTube videos on our website that might help you further along in your research to what's going to help you best. So I hope you guys have a wonderful day and take care.